Hey, this is Dr. Ben Weitz, host of the Rational Wellness Podcast. I talk to the leading health and nutrition experts and researchers in the field to bring you the latest in cutting-edge health information. Subscribe to the Rational Wellness Podcast for weekly updates. And to learn more, check out my website, drweitz.com. Thanks for joining me, and let's jump into the podcast. Hello, Rational Wellness Podcasters. Today, our topic is the 3 stages of menopause with Dr. Felice Gersh. Dr. Felice Gersh is a board-certified OBGYN, and she's also fellowship trained in integrative medicine. Dr. Gersh is a director of the Integrative Medical Group of Irvine, and she specializes in hormonal management. Her website is integrativemgi.com. And she's available to see patients at 949-753-7475. Dr. Gersh lectures around the world, and she's just written her 3rd book, Menopause, 50 Things You Need to Know, What to Expect During the 3 Stages of Menopause. Her other 2 books are PCOS SOS and PCOS Fertility Fast Track. And she's also published a very influential paper in the prestigious journal Heart, which is part of the British Medical Journal family of journals, Postmenopausal Hormone Therapy for Cardiovascular Health, the Evolving Data. Dr. Gersh, thank you so much for joining me again.
Well, it's always a pleasure.
So how should we think about menopause? I mean, what is menopause? Is it just a normal part of aging? Is it a disease? Is it, what is menopause?
Well, it is definitely a normal part of aging, but a very negative one. So, if it depends on how you want to look at all the diseases of aging. So menopause is not a disease, but it is sort of a staging event that can lead to many of the diseases that we associate with aging. In fact, that's been a very big discussion, which has been very frustrating for me when I was looking on from the sidelines, like so many things that are attributed to just aging, like chronological age, have really been misguided because they're missing that, I always say, the critical ingredient of the hormonal ingredient, like what's happening to women when ovarian function ceases and they don't make any more estradiol and progesterone from their ovaries. And that is, of course, related to age, but it is also independent of age in that, for example, if a woman goes into a surgical menopause, like, for example, her ovaries are removed for some disease entity, or she is unfortunate, one of those women who has premature ovarian insufficiency, where her ovaries stop functioning at a very early age, then, well, all those conditions start to accelerate in their presence. So we definitely don't want to think of everything that happens to women as just related to their chronological age. So that's why I really want to bring back the picture of menopause as natural, but negative. So I always say, well, nature is beautiful and wise, but also can be quite cruel, So the same nature that brings us beautiful sunny days also brings us tornadoes and hurricanes. So we just need to recognize the boundaries that we have in terms of what we can do about menopause and all of its subsequent negative effects, and what we can, really take charge of. We can't avoid menopause. I always said, Benjamin Franklin, who was very wise also, but a guy, he said something, to paraphrase, there are certain things in life that are, never going to be done away with. And that was death and taxes. And I said, wait a minute, just 1 minute here. What about menopause? We can't escape menopause, at least at this time. Although I hear there are some people working on, cloning ovaries, but, that's not happening quite yet for the market. So,
right.
Yes.
Well, it's interesting. The discussion about whether or not menopause is a disease is, there's also a discussion in the longevity section of medicine, whether aging is a disease, and a number of doctors are lobbying for aging to be a disease, so it's easier to justify treatments for it.
Well, yeah, I would probably draw the line of calling aging and menopause diseases, but I would say that we need to look at what is happening. I'm always into mechanisms. I know you are too. Like,
well, theoretically, of course, we don't want to see aging as a disease, but the way our healthcare system is, where, we don't do anything for prevention, you have to call something a disease before you can even justify treatment.
Well, if we need a CPT or ICD-9 code, or I guess, and for menopause and aging, so that we can actually get coverage for caring for people, then I'm for that. If that's, I have to be pragmatic as well. I'll buy it.
So let's go into the stages of menopause, and the first stage of menopause is perimenopause, which is kind of like really the stage before menopause, but you're sort of approaching menopause, right?
Well, I have to work with the existing vocabulary. So if it were my choice, I would abolish the word menopause, because it has really misguided so many people into viewing this process of ovarian aging or ovarian senescence as really about the end of periods. And when, by arbitrary definition, menopause is defined as 12 consecutive months without a spontaneous period. That is completely arbitrary. There's nothing in nature that points to that as anything other than it's part of the process. So part of the reason I wanted to do 3 stages, I can't get rid of the word menopause. I mean, that's stuck. In medicine, we've tried to change words, and the old word is just added to the new word, and everyone falls back to the old word because that's what we feel comfortable with. So I'm not going to abolish the word menopause. So I have to work within that context. So to try to show menopause as what it is, it's ovarian senescence, and it's an evolving process. That's why I somewhat arbitrarily created the 3 stages of menopause, so that people would see that there's like the prelude to this arbitrary definition, and then there's like the first decade. And I put, the first part of menopause, after the premenopause is 10 years, because
maybe you should come out with 2 versions of the book and call one ovarian senescence and call one menopause, and see which gets most attention.
Okay, you know what, that's an idea. I'm going to hire you, marketer. But we have to stop thinking of menopause as like you cross a finish line and like you're there, like the event is happening. I made it, and I'm still alive. I don't know, but to view it as what it is. I mean, in fact, of course, aging. People always talk about like the minute you're born, you're aging. So, but the bottom line is that there are certain things that will say accelerate the negatives of aging or of the process of menopause. And we need to understand this if we're going to actually put into place some pragmatic ways of approaching it. Just because it's natural doesn't mean we ignore it or embrace it. In fact, everything in medicine is about recognizing things that may be natural, but are negatives, and then doing things that are completely unnatural to try to get people back to that state of homeostasis, right? So, everything that is, medicine, even going back to the days of, say, in a tribe where you had like the person who was in charge of healthcare in a tribe, they were incorporating natural things, like I call it green medicine. They were looking for plants that could reverse a fever or a pain or something. So everything is about harnessing whatever tools we have to reverse something that's happening that we don't view as a positive, like all the stages of menopause and all the symptoms I put in there that people will often experience, and what we can do about it. And recognizing really that the takeaway is so essential from the get-go is that menopause is not a one-time event, and that it's an ongoing process, and that it's a gradual process involving the declining function of the ovaries, which actually does parallel the declining state of fertility. I mean, that's not an accident, and
Right.
and then that once you also, I keep telling people this, and I wanted to like really come home to roost, that every process in the female body is designed to support fertility. Now, we don't like to think of, like our bodies are designed just to procreate, but, we just need to recognize that we as humans are so unique in that we actually try to determine our reproductive destiny, whereas no other creature on this planet says, oh, this is not a good year to have a baby. I mean, that is just not happening. And so, or like, I think I'll go on birth control, for the next 20 years. Now, that doesn't happen. I mean, we do that to our pets, when we castrate them, but nothing happens naturally in nature that involves trying to control reproductive functions. And since sort of the prime directive of life is what it is, it's the most amazing thing of life. Remember, I've delivered thousands of babies, and it never ceased to just astound me that this was actually happening. A baby was coming out of another person. It's like, wow, this is like amazing. And, that is really the prime directive of life. So every system in the female body is really designed to help to have a successful reproductive status and have healthy babies and do it multiple times. And pregnancy is such a stress test of women. It's such a challenge with altering the cardiovascular system and changing the immune system. All these systems in the body are so amazing. And I say that the hormones, estrogen, progesterone, they are really like the glue that glues all of these different functions in the body involving metabolic functions, cardiovascular, immune functions, everything in the body to the reproductive functions. And in fact, all of the different enzymes, pathways are actually reproduced in the reproductive tissues that are out there in the peripheral tissues. So it's a sink or swim together body. That's like the takeaway. When you lose reproductive functions, when you go through this dynamic change and your ovaries are no longer going to be ovulating, putting out the eggs, you really can't have babies anymore. All of the systems in the body have this profound, change that occurs in them because of the loss of this like vital force in the female body, which are these beautiful rhythmic hormones. And we need to recognize that and be honest about it, and then decide, okay, what are we going to do about it? And that's really my mission, is really to first educate, because you'll never solve a problem if you don't first define the problem. And the problem, I call it natural, but I call it a problem for women, that menopause is a problem. And if you cannot define that problem, I mean, I can consider a premature death as a problem too, right? So if you define a problem, then you can come up with viable solutions to that problem. But if no one even understands, like, what is menopause, what is happening, what are the implications, then clearly we'll never have any viable solutions. And that's not going to help women everywhere.
So how do we know a woman is in perimenopause?
There is actually no test. So it's a clinical, how we do have clinical. I mean, I can't believe this, but I actually am a very old-fashioned doctor. I do observe, I take a history, I do an exam, So we know 100%, since 100% of women are going to go through menopause, that at a certain age, it's going to be a process of ovarian decline and fertility decline. Now, women will manifest the symptoms quite differently. I mean, there's a huge range, but every woman, once she hits the age of 40, is definitely going to be having serious fertility changes and serious changes in her hormonal production. Now, we can do certain tests. I said there aren't any, but you could do like a menstrual mapping. And so it's very interesting because I've done a lot of those tests, and that's not really mainstream at all. But if you take a woman, and what's very classic for women as they are in the last decade before the end of cycles, we'll call it, they will often have changes in their menstrual cycles, but they're still having them. So often the cycle will become shorter. So then you think, okay, like, why is the cycle getting shorter? Like, what's happening? If you do a menstrual mapping, then what you will often find is a shorter luteal phase. And what happens is the estrogen spike that precedes ovulation is dampened down, and then you'll see a dampened progesterone response. So the progesterone should have this nice rounded sort of like little mountain, like a hill. And then instead of being like that, it will often be like this. It'll have a little spike and then it comes down. So you'll actually see that the progesterone is produced in a lower amount and also in a shorter period of time. And of course, everyone should know that progesterone is essential for the establishment of a pregnancy. That's why in like IVF clinics, they're always giving progesterone, right, to everyone for the first 3 months or so, because progesterone is essential for proper implantation. It works with the endocannabinoid system, so it's all complex. But if you don't make an adequate amount of progesterone for a long enough period of time, and then allow the placenta to take over and so forth, then you're going to have a miscarriage, and miscarriages are much higher in their incidence in women who are older, like in their 40s and such. So the bottom line is that there's a test. And then you could do things like FSH.
By the way, on the cycle mapping, just for those listening who don't know what that is, can you just explain what cycle mapping is?
Sure. Well, it's a wonderful test that can help with many diagnoses, like, say, is a woman having an inadequate spike of estrogen or LH spike, and they're having fertility problems, they're having PMS, and so on. And what it looks at is through urine, by measuring urine multiple times during a cycle, you actually get a mapping. So if you've seen a menstrual cycle that's been sort of graphed out over, like I say, a 28-day, you see the estradiol, and it goes up, and then you have the big spike, and then it comes down, it dips, and then it comes up, and then if you're not pregnant, it goes down. And then you see the LH, and then it will have a big spike right after the estradiol spike. And then you see the progesterone coming up right after, ovulation. And then if you're not pregnant, it goes down. That all of this gets mapped out on your graph. And then you get to compare it to like an ideal one. And then you can see, okay, oh my gosh, now it's only telling you that one cycle, but hopefully it's a classic, typical cycle for that particular woman at that stage of life. And what you can see is her estrogen in the estradiol level is not right, or you see the LH maybe like hovering too high because she's perimenopausal and she has too much LH. And then we also see the progesterone, which often will be inadequate in its quantity and duration. And so you can really help, like, oh, a woman has PMS, and then you say, oh yeah, her progesterone level or her estradiol level is really totally inadequate. And then we can, instead of just randomly giving people hormones and saying, here, I'll just give you this hormone and see. No, it's a much more scientific approach to actually measuring and then treating and then seeing the monitoring for the effect. So I love, to be evidence-based. I hate to just be throwing hormones at people, which is done too often.
And this cycle mapping is available through Precision Analytical, which it's part of their suite of Dutch labs, and also through ZRT.
Right.
And this is a kind of test that you might get from a functional medicine practitioner, gynecologist like yourself, which is you're not going to get this from a conventional medical gynecologist or hormone specialist.
It's really actually when you realize what you're getting and how valuable this information is and how completely off the grid it is for the standard OBGYN, it's really sad. So for those of you out there, this is a very easy to interpret, and the labs will also help you to interpret them. And they give a lot of examples. And it's really fascinating because I have found that so many women who have even regular cycles, when you look at their hormone production, it's really not optimal at all. And it's very interesting when you see the perimenopause and you see where sometimes they'll have an overshoot of estradiol and you have a really high sustained LH, and so these are really interesting. These are not standard run-of-the-mill kinds of approaches, because in the standard conventional world, they do not do anything for perimenopause. They don't even really recognize perimenopause. They just mostly, I hate to say this, but they put women very frequently on SSRIs. I mean, that's like the go-to, really it is, because women are having a lot of symptoms and they always say, oh, another, crazy woman. I hate to say, and then like, why don't you just go on some, Prozac or Lexapro? This is like standard of care, which is really, frightening, because that is not addressing we talk about root cause. That is not the root cause. And
unfortunately, it's part of a small bucket of drugs that are used for conditions where they don't know how else to treat. So SSRIs are used for perimenopause. They're used for irritable bowel syndrome. They're used for sometimes chronic pain patients. When you don't know what else to do, try an SSRI or try a PPI or try an NSAID or.
Right. When you know that these hormones are very involved in every organ system, including the brain. So they're involved with both cognition and with mood. And now it's been published that the majority of women, as they are going through the perimenopause, so in their 40s, they will have mood swings, sleeping disorder, and also some brain fog. And so the go-to is traditionally to go on an SSRI, and upwards of 25% of American women in their 40s are now being prescribed an SSRI. So that gets back to my, let's define the problem so we can get a better solution than that, because SSRIs
and by the way, these drugs are not benign. They're very difficult to get off of. And we're manipulating brain chemistry in a very narrow way. And we really don't have much of a clue as to what we're doing.
And it's really interesting because during the perimenopause is when bone loss is actually accelerated. It's not really well recognized because you don't have the fractures, but you have that accelerated bone loss as the hormones are going down. And SSRIs increase the risk of osteoporosis. So I call these the crazy maker drugs. There's a ton of them. They actually promote the very problems in the specific demographic that we're trying to avoid. And then we go on a drug that actually promotes the very condition that we ultimately are trying not to have. So
I've really been enjoying this discussion, but I'd like to take a minute to tell you about a new product that I'm very excited about. I'd like to tell you about a new wearable called the Apollo. And this is a device that can be worn on the wrist or the ankle, and it uses vibrations to stimulate your parasympathetic nervous system. And this device has amazing benefits in terms of getting you out of that stressed out sympathetic nervous system and stimulating the parasympathetic nervous system. It has a number of different functions, especially helping you to relax, to focus, to concentrate, to get into a deeper meditative state, even to help you sleep. And there's even a mode to help you wake up. And this all occurs through the scientific use of subtle vibrations. For those of you who might be interested in getting the Apollo for yourself to help you reset your nervous system, go to apolloneuro.com and use the affiliate code Weitz10. That's my last name, WEITZ 10. And now back to the discussion. Let's talk about some of the lifestyle factors and or nutraceuticals that can help manage a woman with perimenopause.
Well, I love phytoestrogens. So now poor phytoestrogens have also gotten a bad rap because people don't understand them and they think that somehow they promote all kinds of diseases when they actually are quite the opposite.
Like breast cancer.
They're actually not. They don't, if you eat organic whole soy, you're not promoting breast cancer. It's actually, these are actually agonists for the beta. Now, recognize plants are not estrogen. So it's a miracle of nature that certain plants can actually bind to our own receptors. I mean, it's just like cannabis binds to our endocannabinoid receptors. And so we have this miracle of nature where plants can bind to our own receptors for our own benefit. And there are a whole group of different types of plants, and we can do plant extracts as well and utilize them for helping to maintain gut health. And there's actually a very interesting study that came out just maybe 3-4 months ago that showed that if you had an organic soy-based diet, like a cup of organic soy, like tofu or edamame every day, that by the end of 12 weeks, hot flashes, night sweats, and sleep problems, which are so prevalent in this transitional time. And of course, it can go out for almost 20 more years. So it's not just, it can go on for a very long time, that something like close to 90% resolution of these symptoms just by including these phytoestrogen foods, which is amazing, really, because they bind to the beta receptor. So estradiol has at least 3 receptors and, variants now, like, there's offshoot receptors, but the primary receptors are alpha, beta, and a membrane receptor, and they have prevalence throughout the body, but in different proportions, and they have different effects, and they actually up and down regulate each other. They're very interactive. And it turns out that certain foods like soy and flaxseed predominantly bind to beta receptors, and beta receptors are in the cerebrum of the brain. And so it helps with that type of function. And as well, the gut lining cells are mostly beta. So it helps with gut. Now, unfortunately, the bone is more alpha. So it hasn't been shown to improve bone health. So it's not like a panacea. It's not a panacea. And it's not like having estradiol, but these are ways of harnessing nature's gifts to us to help us to feel better, sleep better. And all of those things are going to improve quality of life dramatically. So I recommend including organic. First, of course, if you have a food sensitivity, there are people that can't eat some of the healthiest foods on the planet because, of leaky gut and how their bodies have modified their ability to deal with them. But assuming you don't have that problem, and you can do elimination diets and check it out, but assuming you don't have a problem and you can eat organic, whole, unprocessed soy or minimally processed like tofu, and include that on a regular basis, along with a couple of tablespoons of flaxseed, that alone can have dramatic effects. And in terms of supplements, you can harness like the Siberian rhubarb, the root of that plant, is also a phytoestrogen that is all beta. That's been well tested. And then
let me just clarify for someone who don't understand. Phytoestrogen stands for plant estrogen. So these foods like flax and soy contain these plant compounds that are very similar to the estrogen that's in your body and attach to those estrogen receptor sites. And then the question is, do they have negative effects? Like, could they increase the risk of breast cancer or some of the negative effects that can happen? Or are they more likely to have positive effects? And a lot of the data seems to show that most of their effects are very positive, that in some ways they block out some of the toxic estrogens that are found from toxins in the environment, like pesticides and all these other chemicals. And so you'd much rather have phytoestrogens attached to your estrogen receptor sites than estrogenic substances coming from petrochemicals or pesticides or et cetera.
Plastics, right? And absolutely. So these, if you look at the chemical structure, they have a little bit of the molecule is similar enough so that it can actually bind and have a positive effect. And then there are other foods that can also have that people don't even realize, like pomegranates, which have been called like a superfood. And that people don't realize that from pomegranates, you get urolithins. And the urolithins are like the breakdown from the different polyphenols, the ellagic acid and so on. And these actually can also be phytoestrogen effects. So many of the foods that are called superfoods, when you actually find out about it, they're actually phytoestrogens. So it's amazing. Like so many so-called superfoods actually do bind to estrogen receptors because, of course, men, I always say, should love estrogen too. They have tons of estrogen in their body. They just make it locally on site in the different organs from their testosterone, because all estradiol is derived from testosterone, and men just do it on site. Women make it in their ovaries and then disperse it. And of course, we have different quantities, different ratios. But in the end, these foods can also be beneficial. And breast cancer, by the way, is virtually always, when it says estrogen receptor positive, it's working on the alpha receptor. And like soy, flaxseed, they're beta receptor. So they're more like estriol, okay? And they actually, we know that when you have a lot of beta receptor stimulation, it actually down-regulates alpha. So it's like an interesting thing. So it's a little bit like taking raloxifene or tamoxifen, but better. These are drugs that have other interesting but not desirable side effects. So it's nature's own way of giving like these drugs that are actually marketed, like raloxifene, which is also called a SERM, but the name SERM is not supposed to be used anymore. But like I said, nobody ever gets rid of the old words. So that stands for selective estrogen receptor modulator. But now you're supposed to say estrogen agonist/antagonist. So it means that it's like it depending on the location and the receptor, it either acts as a pro or a con. You know, it stimulates or it blocks. So that's like the new word, but we always say SERM anyway. So this is a drug, a pharmaceutical, raloxifene, and the brand name is Avista, that has an FDA approval for bone health and to help reduce fractures of the vertebra, not of the hip. They haven't shown hip. But in terms of breast cancer, it's considered a prophylactic preventative to help reduce the risk of breast cancer. Well, you could eat food, and then you get all the other benefits of food, and but those are our natural ways of creating a similar effect to this pharmaceutical. So I say go for the food.
What about topping off the benefits of the food by taking, say, genistein or diazine supplements as well?
So in terms of the isoflavone concentrates, I wish that the data was more robust in terms of its benefits. It hasn't been as good as I would like. I don't know of any real harm, but it seems like you just for those particular isolates of the isoflavones, you do better by eating the whole food. So I don't actually push for those isolates. In terms of others, there's been some extracts from what are called lignans, which are also phytoestrogen, and also, as I mentioned, the root of the Siberian rhubarb plant. That seems so arbitrary, but they figured that one out. And so there are, and then you probably heard of black cohosh. Now, black cohosh has also not quite panned out as well as we had hoped, so they're just not really nature's gift to the world as much as we'd hoped. So, and so I don't really use a whole lot of black cohosh. I do use some of the others, the lignans, and I do use the Siberian rhubarb root, and then I use food. And then, of course, as an MD, I do use hormones. And that's another thing that is not really recognized, that you can give a little bit of bioidentical estrogen, even to women who are cycling. And that's where if you do the menstrual map and you see that their estradiol levels are really subpar, but it's a crazy time also mentioning like the perimenopause, because there's a lot of overshoot. That's the one time when you can have actual estradiol dominance, because people always, throw this term around of estrogen dominance, which I'm trying to get rid of it, because people think of it as estradiol is evil. I mean, and that's not what estrogen dominance is about. It's about poor detoxification, endocrine disruptors. It's not about the ovaries are making too much estradiol. That's not what it is about, but except in one case, and that is when a woman is perimenopause and she ends up having too little estrogen, and the brain, which has a sensor, says, oh, there's not enough estrogen being produced from the ovaries. So I will tell the pituitary gland to make more of its gonadotropins, LH and FSH, to then trigger the ovary to make more estrogen. Well, unfortunately, the ovary is now less responsive because it's running out of eggs and it doesn't really make the hormones as well. So the gonadotropins, LH and FSH, are produced in higher quantities. And when you still have some reserve, the ovaries are not completely done for yet, then you have this giant surge of LH and FSH. You can get a giant surge of estradiol, and you will also get multiple eggs coming out. That's why in women in their 40s have the highest incidence of fraternal twins of any time in a woman's life, because they're getting hyperstimmed. It's like what they do when they're trying to help women to get pregnant, like for infertility patients. And then they give these medications to try to get them to ovulate. And then sometimes, oops, now we got too many. That's why they've monitored. Now, in the ancient days, they weren't so careful. And then people had octomoms, right? They got so many eggs out. Now, sometimes they'll still get twins. They're very careful. They'll just abort the cycle if there's too high of a level. But in nature can do that. And then you get twins, because it's like, oh my gosh, I thought I was like not even fertile anymore, and now I'm pregnant with twins. That happens, and someone's 44. That actually can happen. And so, but women, because they're going through this sort of like, I call it like a roller coaster, where their estrogen is too low, then they have this giant overshoot of gonadotropins, and suddenly their estrogen level is like, I've measured, sometimes it'll come out like, so a typical level for a woman would be like around 100 or so for picograms of estradiol. And then I'll get a level of like 800. It's like, oh my God. So this can trigger like horrendous migraines and sleep problems and mood swings and breast tenderness. And suddenly they get really, really heavy periods, because you can just imagine how much uterine lining is made by all that estrogen. And sometimes if you give a little background, like a little bit of estradiol, it will keep the brain from creating that giant overshoot of, the gonadotropins. So it's like, okay, if you give a baseline of estradiol, the brain won't create this roller coaster effect. And sometimes that can really be a saving grace as women are going through this really challenging time, because the conventional world puts them all on birth control pills. I can tell you that. But that's has its own set of issues as well. So we try to do it and let women still have real hormones, their own natural hormones, but we're trying to tame the monster here a little bit during that time when they can have this crazy overshoot.
So let's go through some of the symptoms of perimenopause. And I want to say, looking at the time, I don't see how we're going to get through all the three stages, because we're still on stage one, but that's okay. Let's do a good job with what we're doing. So
they'll have to read the book.
Exactly. So you mentioned breast pain, mastalgia, and that's often common in perimenopause. And why is that? And what can we do about that?
Well, that's because of this overshoot often of the estrogen. And so the best thing that you can do for that is to have a little bit of patience, and often to take a little bit of, I recommend a little bit of iodine can be helpful. Sometimes that's a sign we have like massive iodine deficiency. So a little bit of iodine can be helpful, but a lot of patients can be really.
When you say a little bit of iodine, you mean like 100, 200 micrograms?
Yes. Okay. Always less than 1 milligram. So yeah, like around 200 micrograms, right? I'm not into like massive dosing whatsoever. But, and then you can do things that reduce inflammation, because remember, pain is always inflammation. So you can take some of the anti-inflammatory herbals is very helpful. And just also recognize
curcumin or
yes,
fish oil.
I love all of those things, right? Everything. And then having, the anti-inflammatory lifestyle. And, really it's so important for women to know that this is just a stage, that it's not associated with breast cancer, because sometimes reassurance is the best medicine rather than going on, pharmaceuticals for something like that.
And so what about if the balance of the estrogen and progesterone is tipping, that the progesterone is starting to go lower and maybe getting these spikes of estrogen? What about using something like chasteberry to help the body produce more progesterone?
Yes, absolutely. So chaste tree, also the Latin name Vitex, is often referred to as the woman's herb. So it has actually, reasonable data that has been accumulated showing that it can help with PMS and breast tenderness. And those are really key problems that often go together, actually, because they're all, it's a hormonal imbalance. So yes, chaste tree is, Vitex is a very, very useful herbal for treating breast tenderness. So
and what
definitely.
dosage for that do you like?
Well, usually about 200 is a very good dose.
Okay.
And it's for taking it, I always recommend just take the whole dose in the morning, as a morning dose.
I'd like to interrupt this fascinating discussion we're having for another few minutes to tell you about another really exciting product that has changed my life and the life of my family, especially as it pertains to getting good quality sleep. It's something called the Chili Pad, CHILIPAD. It can be found at the website chilisleep.com, which is CHILISLEEP.com. And so this product involves a water-cooled mattress pad that goes underneath your sheets and helps you maintain a constant temperature at night. If you've ever gotten woken up because the temperature has changed, typically gets warmer, this product will maintain your body at a very even temperature, and it tends to promote uninterrupted quality deep and REM sleep, which is super important for healing and for overall health. And if you go to chilisleep.com and you use the affiliate code Weitz20, that's my last name, WEITZ 20, you'll get 20% off a Chili Pad. So check it out, and let's get back to this discussion. So fibromyalgia, that's a not quite fully understood condition, seems to be fairly prevalent. Patients get pain throughout their body, up and down their spinal cord. How is this related to perimenopause, and how frequently is this seen?
Well, it's seen all too often, and it's primarily in females. And that's why it's kind of been sort of swept under the rug quite a bit and treated a lot with Prozac in the past, and still treated with Cymbalta, which is duloxetine, which is in the SSRI, SNRI family. And it helps because it's interesting because some of the same centers in the brain that deal with pain response also deal with mood response, and so they, in terms of pharmaceuticals, some of the drugs that are used are like gabapentin and so on, but we can do a lot without turning to the pharmaceuticals. So understanding that there is a strong relationship to hormones. All of the hormones have a lot to do with balancing our endocannabinoid system and our opioids, our natural endorphins. And it turns out that these hormones are very involved, all of them, progesterone, testosterone, estradiol, in terms of the relationship of this, these different other systems of the body. We have all these different interesting systems involving signaling agents. We have the peptides and we have the fatty acids, which are, involved with the endogenous opioid system and the endorphins. And we need to have proper hormones for transporting these molecules into the brain, for having them function properly in the brain, for balancing all of this. And we now know that although fibromyalgia doesn't typically have systemic inflammatory markers present, that they can actually be in the spinal cord. So it still comes back to pain is inflammation, and it's going on in the central nervous system. So we still need a lot of research on fibromyalgia, but a lot of mind-body medicine can be helpful. Trying some balancing hormones, I find, is actually very beneficial. And sometimes gentle body work, but not heavy, not pushing too hard, but, like gentle body work, lymphatic massage, mind-body medicine, and sometimes short-term, some of the pharmaceuticals. And once again, all of the anti-inflammatory herbals. It's amazing how we now know that without adequate vitamin D, you're going to have more pain. Omega-3, you're going to have more pain. So, and we know that people have often very bad diets that are lacking in the antioxidants, the polyphenols. So just getting on a diet that is plant-based, filled with different colorful vegetables, fruits, and proper fiber, because I'm sure and we need more research, but there's always a relationship to the gut microbiome. So anything we can do to improve the gut microbiome, have proper short chain fatty acids like butyrate, that's going to affect the brain. And so we definitely have to work with lifestyle, mind-body medicine, and gentle exercise can be also, like stretching and yoga can be incredibly beneficial.
And some of the data seems to indicate that fibromyalgia is related to mitochondrial function. And
estrogen is like also the under-recognized, because a lot of people talk about aging is related to mitochondrial decline. And estradiol is essential for every single function that is involved with the production of energy in mitochondria. And also not just the production of energy. Most people in the functional medicine world know that when you produce energy through oxidative phosphorylation, you're also creating oxidative stress. And this, like with superoxide. And it turns out that estradiol actually is key to regulation of this very essential enzyme, superoxide dismutase, which helps to like detoxify this toxic oxidative stress molecule, the superoxide. And so without that, you then have destruction of the cell and of the mitochondria. So the bottom line is that estradiol comes back to, yes, you need estradiol to manage your healthy functional mitochondria. And absolutely, mitochondria are the energy producing factories. If you don't make energy, you're not alive. In fact, everyone knows if you flatline, that means you're not alive, right? And you need energy, and that's like the spark of life. And estradiol is like the spark of life by helping mitochondria to make that critical energy.
And certain minerals, zinc, copper, and manganese are precursors for SOD. So those that's why so many people have essential deficiencies of these key. I always say you can't work the machinery of your cells if you don't have the right nutrients. That's why everyone like who comes in and weight gain, I know we'll have to come back after, but in terms of like the gaining of the weight and the fat redistribution, which is so distressing to women. And we know that this can also be very much related to declining estradiol levels, but we can do so much about that, not just taking hormones, which is just part of the equation, but doing proper stress management, because there's nothing that contributes to belly fat more than high chronic levels of cortisol, right? And we've got to work on our stress and our sleep, and exercise revs up mitochondrial function. We know that you can have mitogenesis just by having great exercise. So we have to work with what we have. And this, I say, that's why I dislike really to the bottom of my heart, like centers that are just like hormone distributing centers, that's like, I mean, I'm not going to compare it to like opioid distributing centers, which existed, like where people would come in and get their dose of, an opioid every month. But just giving out hormones is offering false hope, because hormones are just a piece of what makes women healthy or men healthy. You can't just give hormones and expect that's it. No, you have to do all these other things. You need to have stress reduction, sleep, and so on. And then because this belly fat thing is so harmful to women's self-esteem, and of course it's a metabolic poison and creates that chronic state of inflammation, creating that, that well-known term inflammaging and so forth. Yeah, this whole concept of fat loss and why different people gain fat in different areas, whether it be more in the abdominal region, more in the hips, more in the back, etc. It really hasn't been studied that much, but we know it's related to these different hormonal balances. I remember the late Charles Poliquin, who was not a medical doctor, but a very interesting practitioner of exercise and recommendations about nutrition. And he would have these categories for, this is an insulin dominant person, is a cortisol, based on where their fat was distributed. And that's something I think we really should be given some more attention and study.
Oh, absolutely. And we're always challenged, as you brought up earlier, with these ubiquitous endocrine disruptors that are really metabolic poisons. And then when you don't have your proper production of hormones, then what becomes the dominant hormone, if you can call it information. So once you recognize hormones are really like the language of the body. So, and there's multiple different languages, but these are like the main language. So they tell the cell what to do. They're giving instructions. And if you get endocrine disruptors, then you're going to get the wrong instructions and the cell will do the wrong thing, make the wrong protein, for example. And if you have no information, then, the cell goes into a default state, which is pro-inflammatory. The whole body goes into this default state of pro-inflammation. And so it's really interesting when you see estradiol as sort of operating the switch. I mean, it's really, I think of it as a switch that turns the body from pro or anti-inflammatory back and forth. And that's why estradiol is an immune system modulator. So that's why it can be so confusing to people. It's like estrogen causes inflammation. Oh, estrogen is anti-inflammation. Well, it's both. It's because it's modulating the immune cells. So that's why when you get a pathogen that tries to get into your body, it's estrogen in the form of estradiol that triggers the macrophages to become activated and the mast cells to become activated. So it basically revs up your innate immune system. And then later, it also, of course, triggers the production of antibodies, but then it dampens down. It flips the switch so that you go back into the homeostatic state where you have an anti-inflammatory state. So estradiol, when you have proper production, it modulates this entire immune system response, which of course is also activated if you have damaged tissue. And then when you don't have it present, you end up getting into this default system where you end up in a chronic state of pro-inflammation. And that leads down the path to all the other things that happen in the other stages of menopause, like hypertension, and heart disease, and then really the fractures and the disintegration of your joints, and then having the osteoarthritis. So all of these things stem from really loss of this modulation of the immune system that regulates how you're either pro or anti-inflammatory. So it's really,
it's hard to get my head around exactly how it affects immunity, because we know that women tend to have stronger immunity prior to menopause. And yet after menopause, they seem to have increased autoimmunity. So if the estradiol is so crucial for immunity, and then the estradiol drops after menopause, shouldn't they have less autoimmunity rather than more?
Well, it's interesting because it depends on, there's different types of cytokines and the different immune cells, but every immune cell in the body has estrogen receptors, and the dominant receptor on the cells that make antibodies is the beta receptor. And the dominant receptor on the innate immune cells that make the inflammatory cytokines are predominantly alpha. So you have this sort of balance between this whole immune system that is then lost. And when you don't have enough estrogen, and this has been shown, the innate immune cells will release their inflammatory cytokines at a lower threshold of stimulus. So you get altered gut microbiome. This has been now shown. When you lose your estrogen, the microbes in the gut transform into a different set of population. And then you lose your protective mucus coating and you have the impaired gut barrier or leaky gut. And as these endotoxins and the lipopolysaccharides cross between the lining cells into the gut-associated lymphoid tissue, where 70-80% of the immune system resides around the gut, these innate immune cells are triggered through the toll-like receptors that activate them, that the little dendritic cells, they put their little fingers into the gut and then they communicate, they all line up. And then you have this explosion of production of inflammatory cytokines. But as well, you have the connection between these innate immune cells and the lymphocytes that are in the Peyer's patches. And these are like segregations of lymphocytes that make antibodies that are embedded in the gut-associated lymphoid tissue, and they make antibodies and they communicate through these different types of toll-like receptors. And so they are then triggered into making antibodies. So when you lose estrogen, you actually lose a lot of your control over all these incredibly critically important and very complex functioning immune cells. So you end up with that situation. And we know, for example, when you're exposed to a lot of endocrine disruptors, and I was trained in environmental medicine under Dr. Walter Crinian, who I just miss every day because he's like an amazing pioneer in environmental medicine. And basically, his foundational tenet of life is most problems are due to pollution and what is altering the way our bodies are functioning, because we're getting all these ridiculous toxic chemicals into our bodies. And that most of the autoimmunity that people are now facing in younger years is because these are endocrine disruptors that are interfering with the normal signaling. So then that promotes early onset, like, Hashimoto's, which is like epidemic, and also lupus and multiple sclerosis and such in younger people. And then in older women, rheumatoid arthritis becomes really like prevalent. And that's, of course, you can have endocrine disruptors that are contributing, but it's really the loss of the control of the immune system's, homeostatic mechanisms by loss of the estrogen. And then the immune system goes into this like crazy state of producing lots of inflammatory cytokines and then communicating with the lymphocytes to make these antibodies. And that's why we now know that like these autoimmune diseases like rheumatoid arthritis are not just associated with joint damage and motor disabilities and pain, but also with cardiovascular risk. That because you have a systemic state of inflammation, so it's affecting the immune system on multiple levels. And that's why you really want to be proactive, because we want to be helping women with both diet, lifestyle, and hormones so that they don't get rheumatoid arthritis, which is really incredibly prevalent and really harmful in just a myriad of ways. And that tends to show up down in the later phases. But the precursors are happening in the perimenopausal years when the immune system is starting to get this hit of lack of hormones. So, and then of course, the immune system is everywhere, including in the brain. And so women who have loss of the hormones have a much higher rate. And this sounds so politically incorrect, but I have to just tell the truth. Women have over 2 times the incidence of Alzheimer's as men. And it's not an accident. It's because their immune cells in the brain, which are these specialized macrophages called microglia, when they don't have the proper estradiol to regulate their function, they too go into this sort of default state, like weapons of mass destruction, and they produce enzymes. All these immune cells, these macrophages, produce enzymes that are designed to dissolve pathogens and damaged tissue and then gobble it up. And that's our like cleanup crew, our damage control mechanism. But what happens when they can produce and release these dissolving enzymes for no good reason? And then they dissolve our brain, and then the brain, that's when the brain tries to have a healing mechanism, and then it produces the beta amyloid. So that's why getting rid of the beta amyloid doesn't prevent Alzheimer's as they wished, because it's a response to these out of control microglia, these immune cells that are producing all of this inflammatory response. But this is what's happening elsewhere. That's what's happening in our arteries, So it's like a similar, thing that's happening in different organ systems. And, that's why I love talking to you, to get the word out, because these are not insolvable problems, but right. Once again, because it sounds so terrible, the future is so grim, but we can actually do so much to ameliorate all of these issues.
But it's going to take a lifestyle programs. It's going to take more of an integrative functional medicine approach, and there's not going to be one drug that's going to solve it.
No,
so we're going to have to wrap here. So I was worried about getting through the 3 stages of menopause, but we didn't get halfway through the first stage. But buy Dr. Gersh's book.
Well, now really, I just wanted to give a slight plug. It's not book that you have to read from beginning to end. It's like a little compendium, like a little mini encyclopedia. So you can just like pick out like one of my favorites, because I see women all day long and they look in the mirror, because that's what we do. And we say, what's happening to my lips? Like, why are they getting so thin? So it's like, well, this way you can like say, okay, I don't know why my lips are getting thin. So you can just look it up in the book. Or, like, why am I getting breast tenderness, like you said? Or, like, what's happening to my bones? So you can just pick up any topic you want and just, look up, the stage of menopause and what's happening with that particular symptom and why it's happening. And then, what you can do about it. So you don't have to sit down and just read it cover to cover. It's like a reference book.
Thank you, Dr. Gersh. And how can listeners and viewers get a hold of you, and where can they buy the book?
Well, it's on Amazon, and I am actually in one of my exam rooms, so you can find me in my office pretty much every day.
Is the book available on other booksellers?
Well, it should be, but right now it's just as you probably know, there's a supply chain problem. They're actually having trouble printing books. So isn't that like amazing? So right now it's just on Amazon because it's just hard to get printers to print books. So, we're just limiting it to Amazon for right now. And that's what the publisher said anyway. So I go with what they say, what they tell me. But my office is in Irvine, sunny, usually sunny. It's a little cloudy today, but we need some rain anyway. Southern California. And I can do some telemedicine. I can do telemedicine throughout all of California. And for people in other states, now that things are changing, and I do have to see people like once a year in person. Unfortunately, that's the crazy laws that we have, but I can do other stuff remotely. And usually we can manage, because it's a great place to have a vacation too.
There you go. Thank you, Dr. Gersh. Thank you for making it all the way through this episode of the Rational Wellness Podcast. And if you enjoyed this podcast, please go to Apple Podcasts and give us a 5-star ratings and review. That way more people will be able to find this Rational Wellness Podcast when they're searching for health podcasts. And I wanted to let everybody know that I do now have a few openings for new nutritional consultations for patients at my Santa Monica Weitz Sports Chiropractic and Nutrition Clinic. So if you're interested, please call my office, 310-395-3111, and sign up for one of the few remaining slots for a comprehensive nutritional consultation with Dr. Ben Weitz. Thank you, and see you next week.